Rise and shine, y'all. We are your morning commute crew, Vaunt, Justice, and Z. Good morning. Today, we have a very, very special guest on the line. He was the founding artistic director of Cal Rep, Pennsylvania, and the Mon Valley Ballet Theater at California University of Pennsylvania. And now he serves right here on the beautiful campus of William Paterson as our president. So please welcome the one and only Mr. President Richard Helldobler. Welcome to the show, sir.
Hey, thanks so much. It's great to be here. Happy Monday morning, everyone.
Yes, wake up, rise and shine.
Morning.
Wake up, rise and shine.
Yeah. So, I was looking into a lot of things about you, and I saw that you were the founding artistic director, and that you choreographed and direct a lot of dances. Tell me about that, because I come from a family that does choreography and stuff too.
Oh, great. Well, yeah, I started my professional life as a ballet dancer and danced with Twitter Ballet for a long time and around the country. And so my first academic job was in a department of theater and dance, and I was hired to develop the dance program. And so that's how the Mon Valley Ballet Theater started. And we did a production of Nutcracker every fall semester. It had about 250 different people in it, children from the community as young as 5, all the way up into people who were in their 60s and 70s dancing in the first scene. So it was great. It sort of became a big holiday tradition. We did 7 performances that filled the auditorium every year. Families looked forward to it. So it was great. And then that company became so successful that we were the first university company to be invited by the Minister of Culture in Kiev to go over and perform in the Opera House over there in the Ukraine. So that was a great experience. We were there for about 10 days and performed in the Opera House there, which was a great experience for the students. And we had a great time. It was a lot of fun.
Yeah, it's amazing. Well, I want to ask you, you are no longer doing that, but you have been serving what seems to be one of the craziest years thus far, in at least 100 years, I guess we can say. So I want to ask you, first of all, how are you doing, and how has everything been for you personally since school's been back in session?
I'm great. I mean, I think, what isn't, it's certainly a challenge, and nobody can say that it isn't. They always say when you become a university president, there's the presidency that you planned and the presidency that you get. Nobody plans for a pandemic, but once you're handed it, you have to manage it. I think what gives me energy and gives me peace every day is I think that there's an amazing, competent group of professionals at the university, like Dr. Jill Guzman and Charles Lowe, and Mickey Camarada and Student Development and Becky Baird and all those great, Glenn Sherman, who have really done a great job of putting together a plan to manage the pandemic going forward. And we have done a great job in terms of doing that. We've been able to give our students some face-to-face on-campuses experience. Mm-hmm. We didn't believe that going fully remote for our population of students in particular was the way to go. But we also wanted to make sure that everyone could be as safe as possible. And, so far, when you read what's going on nationwide, comparatively, William Paterson has done extremely well. So that gives me energy and that gives me hope. And that means we're doing what we should be doing as a community.
Right. And I'm glad you touched on that, because I did want to get into that, because last week, the university experienced its first confirmed cases of COVID. For those who may be listening, don't know, we've been back on campus in session for over a month now. So as you said, that is relatively well. But how were these first couple of cases reported to the administration?
So actually what happened was the first reported case was the student did exactly what the student should do, which was to fill out the daily health check. Mm-hmm. And that student reported a fever, and we got them into the office within 30 minutes. And that's really how we were able to get our arms around it so quickly. So again, following the protocols of doing the health check every morning, even though I know that's a pain, I have to remind myself to do it. I put a little reminder on my calendar every morning at 7 to fill out the health check, whether I'm coming to campus or whether I'm not coming to campus. And that's really how we found out about that first case. And then we went into contact tracing mode to figure out who the student had been in contact with, and we quarantined people and sent them home, and that's really how we managed it. So it came to light through the health check app. So please, if you haven't been doing it consistently, please just put it on your list of things to do in the morning. Mm-hmm. Brush your teeth and fill out the health app.
How confident has the university been with the students' responses to these daily health screenings?
So actually, the Dr. Jill Guzman, who's been in charge of the pandemic response, has reported that she's really pleased with the rate that students are filling out the health check and complying with the regulations. And I have to say, anecdotally, the first week that I walked across campus, I try to walk across campus a couple of times a week just to get a sense of what's going on. It was a challenge. We had to remind students to either wear masks or staff to wear masks, or in some cases pull it up above your nose. But now when I walk across campus, by and large, people are compliant. And I think that's, a testimony that we haven't had, a greater outbreak of COVID than we thought. We never thought that we wouldn't have any. We always knew we would have some cases. But it's about the ability to manage it and for people to do what they should be doing once they're diagnosed.
Can we really expect, well, I guess I should ask, do you really expect you and the rest of the administration for the community to follow the rules?
Well, I think, if we say that if one of our values is, the care of the community, then we would hope that everybody would follow the rules. We also hope that everybody would hold everybody accountable for those that are not. So if you see someone who's not wearing a mask, say, you should really be wearing a mask. If we see that people aren't social distancing when they should be, we need to remind them to social distance. And look, I get that. That's hard, right? Especially if you've come to college for the first time and you're looking for that first time away from home. You're looking to make friends. You're looking to create a support network. That gets challenging. I'm a very interpersonal person, so I love being with people. And so it's been a challenge for me as well. But if we really care about the health and safety of the community in which we live, and we say that we're a community, then we have to be responsible for following the rules and hold each other accountable when we see that we're not doing it.
Now, for those people, for the couple of students, or I'm not sure if it's faculty, but for whoever's been caught on campus without wearing masks, are there some type of enforcement strategies in place because we all had to sign some type of addendum before we came back on campus?
Correct. So the students signed the Pioneer Pledge, and we asked faculty and staff to sign a code of conduct related to COVID, that we would wear a mask, we would social distance, we would wash our hands, we would do all those kinds of things. And for students who don't follow it, they will go through the code of conduct, disciplinary process through student development. And faculty and staff will go through the disciplinary process through HR if we find out that they're non-compliant.
What is that disciplinary action? Because I know a lot of other schools, I know NYU has this system put in place where if students are caught without masks, then they're suspended for 3 semesters. And I know other campuses have testing protocols, like Kane, they do weekly testing now, or Bloomfield makes sure that people get tested, and before they get cleared, they get 2 negative. So what is that strategy here?
So the disciplinary process is ultimately, it depends. If it's your first offense, we're going to give you a warning. But students have lost housing privileges. They've been released from their housing privileges. They can't come back to the residence halls. Students have been required to be remote for the rest of the semester. Not allowed to return to campus for face-to-face instruction. We've made them remote. If they violate any of those, then we would move to the next step, which would be a suspension. If they don't follow that, then we would do an expulsion. The difference between suspension and expulsion is suspension is for a period of time. Expulsion is you never come back. We haven't really had any faculty or staff, to my knowledge, be disciplined. So I just haven't been made aware of that. I have been made aware of student infractions. The big one is that students keep trying to sneak visitors into the residence halls. That's the big one. And when you bring someone in from outside the community and that we don't know whether they've been tested or where they've been, creates a risk to all of us. And I get it. We reduced the occupancy in the residence hall, so a lot of people have private accommodations. So of course you want to have visitors. You're there alone. But, in the era of COVID, it's just not safe for the community.
I know probably the most confusing part of this pandemic has been people who have had no symptoms. So how do you gauge the health and safety for on-campus students or faculty that may be asymptomatic?
Well, I don't think you can. I think, the approach that we've taken is that once we find someone who's symptomatic, we isolate them and quarantine them and then move into contact tracing. The reason why we decided not to do massive testing is for exactly that reason. You can test someone and they can be asymptomatic and negative one day and positive the next day. So the test is really only good for that day, right? But if you have people monitor their symptoms, once you know that someone is possibly symptomatic, then we think you can move in a more controlled response to that action. And that was a decision that we made early on. Now, we have done some random testing in the residence halls when we found that we've had an outbreak. Luckily, we've done those random testing and they all come back and everyone's been negative. So we hope it stays that way.
So in the unfortunate event that we do have another outbreak, do we have a plan already set for what would happen?
Sure. So we, once we find out once we test and we find out there's a positive, then we move into contact tracing mode. So we would find out what classes, if it's a student, what classes that student went to, and if it was a face-to-face or whether it was an online class. If it's a face-to-face class, we pull the roster, and then we work with the local health department. So this is part of the thing that I think everybody gets confused about. The university doesn't get to determine what the protocols are once you have a positive. Your local health department tells you what those are. So in our cases, it's the Wayne Health Department. So they would look at what the instances would. Dr. Jill Guzman would report to them. They would work out the plan and they would tell us what the outcome is. Now they may say, look, you have a class of 16 students. Those 16 students have to be quarantined. Or in one case, we had a case where a student was positive, but the only class they went to was held outdoors with masks on. In that case, the health department says, well, since it was outdoors with masks and everybody is social distancing, we're not going to quarantine those students, but we're going to ask them to monitor their symptoms. So it really depends on the action and the guidance that we get from the local health department in terms of the course of action that the university ultimately takes.
As far as the contact tracing goes, because you said the one student that initially caught it, COVID, reported it. What about because the email that we got sent out said that the couple of the cases were related. So how were those people notified, and what was the process with that?
Right. So once in the class example, if it's determined that we have to contact the students, the local health department will contact the student and say, you've been exposed to COVID-19. We want you to go and get a test. Or you have a moderate risk. We want you to monitor your symptoms. If you report any of these, coughing, sneezing, fever, tightness in the chest, you're fatigued, report and go to your healthcare provider immediately. And they do that. And then when they meaning the health department, when they've completed contacting all the students, they report back to us to say the investigation and the contact tracing is complete. So if you get that call from the health department, pick it up and answer it. It's important.
So the students on campus that the cases were related, they were contacted by the health department. How soon was that response to everything? Because I would imagine.
It depends on when people answer their phone or not, right? So it's hard to say. But we believe that I believe it happened within 48 hours.
How are you responding to the data coming out that suggests that the surge has arrived now? Instead of, I know you originally planned for the surge to arrive Thanksgiving season, which is why you push up classes.
I haven't really been made aware of any data that the surge is arriving now. We know that there are what they call outbreaks. So if you read the news today, Monmouth reported 36 cases. So it's not really that, I haven't read any data that the surge is coming out now, nor has Dr. Guzman made me aware of any data that would suggest that. But what we did know, and we always knew this, is as the weather, and if you read my Monday morning communication, as the weather gets colder and people are out inside more than they're outside, we expected that cases would begin to increase, right? But you should also know there's no federal definition of a cluster, there's no federal definition of an outbreak, and there's no really federal definition of a surge. What you always are monitoring nationally is that your positivity rate of your testing is at 1% or less. And New Jersey's positivity rate has been about 1.07, I think, in the last couple of days. So we're really trending pretty good in terms of how fast the virus is transmitting in New Jersey compared to other states that are having challenges like Utah right now. That's really what we monitor in terms of the positivity rate. If that positivity rate goes up, then the governor will make a decision in terms of what the state response would be. But his press conference yesterday, he said that he doesn't see us going into another lockdown. So that would tell me that there's some conflicting information out there around the surge, because We haven't been notified of that, and the governor's messaging seems to indicate something different. But if you have that article or data, I'd love to see it. Send it to me.
So back in March, like as the pandemic approached, how did you guys make the decision to like send us home and keep us home?
So that happened really quick. And it happened really quick when, again, going back to my previous point, when we saw that the positivity rate was escalating so rapidly and that we really didn't have a good firm grip on how it was being transmitted. We knew it was from aerosols. We knew it was, but we didn't know the level of transmission through contact, surface contact. We thought that in the best interest of the safety of the community, it was best to keep everybody home. And we did that within 2 weeks. And then we decided that it wasn't even safe to bring the staff back to work. So we shift to remote learning. But that was really based on the rate of transmission and how quickly it was escalating, and the fact that the science wasn't really clear on how it was being transmitted. Now, all these months later, we know that your ability to get the virus from surface transmittal is very, very low. You're most at risk when someone is not wearing a mask and you're not social distanced. That's what we know now based on the science. Back then, we really weren't clear about that. So we thought in the interest of safety, keep everybody home, pivot to online. I know that was a lot of work for our faculty in terms of getting all their classes up online. And it was a lot of hard work for students shifting from that face-to-face to figuring out how to learn online. That was rough, but we did it. Right. And I think, and again, I keep saying to students, I don't think you should really think about this experience as diminishing your education. I think you will be much more tech savvy as a result of this. And if you think about how COVID has impacted industry, being able to navigate in a virtual environment as a potential employee is a plus. And I think that will serve you well as you go into the market, which we know you will be going into the market in May.
Yes.
In response to you trying to bring, I guess, a positive out of all this craziness, what has the response been? Because I know that we got notified, it was like August 14th, that around that time that we were coming back to campus. And I know that that we had to wait for New Jersey to be in a certain stage and stuff. So what exactly, what was what helped guide the decision to bring us back? And then what has the response been so far?
Well, I think, and I'll be honest with you, I was advocating hard with the governor's office and the Secretary of Higher Education, in particular, to be able to bring freshmen back early. And that's why I made the decision to bring the 1,000 level classes back and not bring anything 2,000 or above back until the first 3 weeks. Because I really believe that for our freshmen in particular, connecting with advisors, connecting with success coaches, making friends early on in their cohorts really promotes student success and helps them understand the collegiate experience in a way that they wouldn't if they were fully online. That took some doing. It took some doing to convince the governor that even though that the state was remaining in stage 2, and for all good reasons, that there had to be some flexibility within the university environment to allow us to deliver our stage 3 plans within a stage 2 environment. And I was pushing hard for that. I wrote to the governor, I wrote to the Secretary of Higher Ed, and ultimately he saw the logic in some controlled manner of bringing students back to campus. And I listened to Dr. Jill Guzman and Charles Lowe and the rest of the pandemic response team if they really believed that we could do it safely. And working with Faculty Senate, we developed the instructional plan of this high flex where half the students are in one day, half the students are in the other day. We installed cameras into most of our classrooms so faculty could be teaching live to remotely if they wanted to be. And we tried to provide as many options for students as we could. And we realized that students didn't have the option of when they registered for classes to know what kind of learning modality they would be in. Mm-hmm. I think that, ultimately it's worked out well when you look at our outbreaks compared to other universities. Rowan, I understand, is in triple digits. Monmouth had a huge outbreak. We're doing well comparatively. And I think that speaks to the community, both in terms of following the rules and the quality of our plan. But it wasn't an easy decision, but that's my dog barking in the background. I'm sorry. I think that's that's a testimony to the plan, and it's a testimony to our community's willingness to care for each other, that our outbreaks have been relatively low.
As far as studios and labs and classrooms that meet in person, what are the policies like in terms of like disinfecting and cleaning?
So there's two things that happen. One, there's supplies in the room that we're asking everybody that if you touch a surface, take a Lysol wipe down the surface that you've touched. Also, don't be sure that someone's done that. So if you're coming into a classroom, take up a wipe down your space, make sure you wash your hands, use the hand sanitizers that are there. But those classrooms all get a deep cleaning every night in terms of, we're using the fog guns, we're using hospital grade disinfectants and wipes to wipe down the room. And again, let me stress that we know that surface contact there's very low probability you're going to get COVID from surface contact. It's more when you're with someone and you that you receive their aerosols when they're not wearing a mask. That is the number one focus in terms of transmission.
And have professors and other faculty been trained on the proper sanitary techniques? Because I know, like I said, that these plans kind of weren't implemented for sure until about a week or so before we even came back.
Well, we're not expecting faculty and staff to clean classrooms. We're asking everybody to take personal responsibility for wiping down the spaces that you touch. And when you go into a space, wipe down the surface that you touch or are going to touch again, if you can't be sure that the person before you did it, right? So really what I'm saying to all of you is this boils down to personal responsibility, right? Do it when you leave, and when you walk into a new space, do it again. Wear your mask over your nose and mouth. Wash your hands frequently. If you walk past a hand sanitizing dispenser, put your hand under it just in case, and always maintain social distance so we know that the aerosols can't spread as quickly. It really boils down to personal responsibility.
How come most classes are currently hybrid or online, and yet tuition prices haven't changed? Meanwhile, in addition to textbooks, students now have to purchase things like computers or software licenses or even equipment.
Well, let me talk about the latter part first. So when you look at our NESI data, which is the Student Engagement Satisfaction Survey, most of our students report having more than one technology device, whether it's a laptop, a desktop, an iPad, or a phone. We have a very low percentage of students that don't have any technology a device to deal with the technology. Plus, our computer labs were able to reopen at a reduced occupancy that students could have access to technology as well. One of the things that we did change is that we made it a requirement for this freshman class to have a computer. And why did we make it a requirement? Once the university makes it a requirement, it can be covered by your financial aid, right? In terms of, and you wouldn't have to lay out, if it's not a requirement, financial aid won't cover it. If it is a requirement, financial aid will cover it. So we made that a requirement that all of our students would have that. So we know after 4 years, all of our students would have that option. So I don't think a lot of student expense was laid out in terms of buying technology. And I would say in terms of expense, the cost of delivering the university, the education hasn't changed. You still pay the faculty and staff the same amount. In fact, you have to upgrade your technology in order to be able to deliver the services that we're delivering. So the cost to produce education hasn't gone down. We also didn't get any more money from the state as a result of moving into COVID. So ultimately, the tuition rate in terms of expenses remains steady. And that's why we made the decision not to reduce tuition. We did, last year, we were one of the only universities to refund some fee money. Most universities didn't do that. William Paterson decided that we were going to refund fee money in cases where students didn't have access to facilities where the fee would be expended. So we took that extra step when a lot of universities didn't.
As far as, let's just say there is another outbreak on campus, will anything in terms of what you just said change as far as, because of the fact that people have this equipment and are mainly online now?
Well, we know that because we've moved into this high flex format, that if we have to pivot to online, students are already accustomed to that. They just won't do their physical class day on campus. And we know that faculty have been prepared for that. That was one of the reasons why we chose the instructional mode that we did, that we could offer some face-to-face, which we thought was important to our students, but in the event of an outbreak, if we have to pivot back to online for 2 weeks while we quarantine everybody, then we could do that. And so we're hoping we don't get to that point. But again, it's about everybody acting responsibly and following the rules to help us not to get to that point. Wear a mask, wash your hands, keep your social distance, all those good things.
So 3 weeks ago, a nursing student complained to you that one of her professors said that she had to come home, who had to come in person to her clinical, And when she explained that she resides with her relatives who are more at risk for COVID, the response from the professor and the dean was that then you fail. And even after she rebutted that we did everything online back in March, how can students who can't make accommodations stay on track to graduate within their respective times?
So the current accommodation, according to the CDC and the state guidelines, is that the accommodation, a reasonable accommodation, is if you yourself are compromised, right? Meaning you have one of the conditions laid out. You have diabetes, you have asthma, you're of a certain age, those kind of things. We can't account for people who are living in multi-generational homes because there's no way to verify that and there's no way to document that, right? The reason the difference between March and now is March, we were shut down. Right? Nobody was coming to campus. Now, in cases where we have in-person classes, people are expected to come unless they themselves have an accommodation, right? Ultimately.
We, first of all, want to thank you for this opportunity. And we thank you for answering a lot of the questions that we had.
Hey, thanks for having me on this morning. I really enjoyed it. Rise and shine, everyone. Have a happy Monday.
Thank you so much for being here, President Helldobler. We appreciate you and all that you've done for this school. Once again, ladies and gentlemen, President Richard Helldobler. We have more on the way, so stick around. Happy Monday.